Tired, irritable, forgetful, we all go through that from time to time. But for guys who seem to have it a lot, it could be something more than just getting older.
Trouble is, more and more men are diagnosing themselves with something they may not have. Here's health editor Dr. Maria Simbra.
Dan Gosser had a feeling something wasn't right.
I was swimming 4 or 5 days a week, and I started gaining weight. And doing all that exercise, it was unheard of.
A blood test showed it was an issue of not enough testosterone. But in many cases, men self-diagnose incorrectly.
It's in Men's Health magazine, Sports Illustrated, it's in movies, it's on TV. We're surrounded by this issue of low T.
The symptoms can be fatigue, loss of muscle, an increase in fat, irritability, forgetfulness, decreased libido, and erectile dysfunction. First, Dr. Baga makes sure the symptoms aren't from some other medical problem.
Depression, anxiety, sleep apnea, cardiovascular disease, hypothyroid states, lack of sleep.
Then he will look at testosterone levels. He considers a level below 300 low. If a man also has symptoms, Dr. Baga will prescribe treatment. It could be gels that you rub on, but this can rub off on pets and children. It could be patches, but these can irritate the skin. The more popular choices are long-acting injections given 5 times a year, or long-acting pellets implanted 4 times a year.
We can actually put in little pellets that will slowly dissolve over time. It's about a 3 to 5 minute procedure.
Sometimes it is a challenge to get insurance coverage, and which options are covered can vary company to company. He's very concerned about the men who jump to conclusions and supplement testosterone on their own.
There's a lot of direct-to-patient advertising that's done by testosterone companies. They find their sources, whether it be online, etc., where they'll get the injections. For whatever reason, those seem to be a little bit less regulated or easily accessible. So they'll find that and they'll inject themselves and then they'll come to me later because there are risks associated with that treatment.
Risks like infertility, prostate cancer, and possibly heart attack and stroke.
The important thing is that they come to a doctor to discuss it before they go and start to self-medicate themselves.
Dan gets the pellets.
I really noticed I lost 6 pounds almost immediately, and I'm down another 4.
Even if they weren't covered by insurance, he'd be willing to pay the $2,000 some every 4 months out of pocket.
It's a nice feeling, you start, it picks you up. There's a vitality.
I'm Dr. Maria Simbra, KDKA-TV News.